If you take a blood pressure pill every morning and your ankles look puffy by dinner, that's not aging. That's your medication talking to you. And almost nobody explains why. Garrett Landon. Here's what's happening. If your pill is amlodipine, and for about 40 million people it is, that pill opens up the small arteries in your legs, wide open. Blood flows in faster, under more pressure. But the veins on the other side, they don't open. They stay the same size. So fluid gets pushed out of the blood vessels and into the soft tissue around your ankles. By evening, your socks leave marks. Your shoes feel tight. And you blame it on the heat, or standing too long, or just getting older. It's none of those things. It's physics. Pressure in, no pressure out. And the higher your dose, the worse it gets. At 5 milligrams, about 1 in 10 people get the swelling. At 10 milligrams, it's closer to 1 in 3. That's not a rare side effect, that's a coin flip. And that swelling is the part you can see. There's something else these pills are doing, quietly, to an organ you're not even thinking about, and you won't feel it until the damage is already done. But we'll get there. Right now, I want you to think about something else. There's an item sitting in your kitchen cabinet, not a food, not a spice, something you bought to be healthier, that can turn your blood pressure medication from protective to dangerous in a matter of weeks. And most people have no idea. Think about the last time you had a headache, or your knee flared up, or your back did that thing it does after yard work. What did you reach for? Ibuprofen, maybe naproxen, maybe the big bottle of Advil that's been sitting next to the coffee mugs since last winter. And here's where it gets ugly, because that one pill, that little over-the-counter painkiller you don't even think of as real medicine, fights your blood pressure medication directly, every single time you take it. This is how it works. Your blood pressure pill, whether it's amlodipine, Losartan, or Lisinopril, is trying to relax your blood vessels and let your kidneys release extra sodium and water. That's the whole job. Get the pressure down. Ibuprofen does the exact opposite. It tells your kidneys to hold on to sodium, hold on to water, and it tightens your blood vessels back up. So your blood pressure pill pushes one way and the ibuprofen pushes the other. And the ibuprofen wins more often than you'd think. Clinical data shows that regular use of anti-inflammatory painkillers can raise your blood pressure by 5 to 8 points on average. 5 to 8. That doesn't sound like a lot until you realize your medication is only bringing you down by 10 to 15. So you're erasing half the benefit of that pill you take every morning with the pill you take every afternoon for your knee, and it goes further. When you combine these painkillers with Losartan or Lisinopril specifically, you're not just raising blood pressure, you're squeezing your kidneys from both sides. The blood pressure med is changing how your kidneys filter. The painkiller is reducing blood flow to those same kidneys. Together they can push a kidney that was doing fine into real trouble. Not in years, in weeks. You know what the frustrating part is? Nobody puts a warning sticker on that Advil bottle that says, "Do not take if you're on blood pressure medication." Nobody tells you at the pharmacy. Your doctor prescribes the blood pressure pill in January, and in March, you're popping ibuprofen for a sore shoulder, and nobody connects the dots. So here's what you do instead. Acetaminophen, Tylenol. It doesn't fight your blood pressure medication. It's not perfect, nothing is, but it doesn't cancel out the pill you're depending on to keep your arteries safe. If you need something for pain and you're on any of these 3 medications, acetaminophen is your first option. Talk to your doctor if the pain won't quit, but stop reaching for ibuprofen like it's harmless. For you, it isn't. If any of that was new to you, save this video so you don't lose it. What's coming next matters even more. Remember that item in your kitchen cabinet? The one I said could make your medication dangerous? Here it is, salt substitute. That shaker with the green label. The one that says no sodium or heart healthy on the front. You bought it because your doctor told you to cut back on salt. Good advice. And the substitute seemed like the obvious move. Same taste, no sodium, no problem. Except there's a massive problem, and it's printed right there on the back of the label in tiny letters. Potassium chloride. Your body needs potassium, that's true. But Losartan and Lisinopril both change the way your kidneys handle potassium. Normally your kidneys filter out the excess and you don't think twice. But these 2 medications block a hormone called aldosterone, the hormone that tells your kidneys to dump potassium into your urine. block that hormone, and potassium starts to build up, slowly, silently. And now you're shaking extra potassium onto your eggs every morning from a container designed to deliver as much of it as possible. And you feel fine. That's the dangerous part. Potassium doesn't announce itself the way sodium does. You don't swell up, you don't get headaches. What happens is subtler and worse. Your muscles start feeling weak, not sore, weak, heavy. You might notice your legs feel harder to move, like they're not listening to you the way they used to. Your fingers might tingle. And then the real danger, your heart rhythm changes. Because potassium controls the electrical signal that keeps your heartbeat steady. Too much of it, and that signal misfires. The heart skips, flutters, and in extreme cases, it can stop. I'm not trying to scare you. I'm trying to get you to flip that shaker over and read the back. If it says potassium chloride and you're on Losartan or Lisinopril, put it down. Use herbs, use lemon, use garlic powder, use anything that isn't pumping potassium into a system that's already holding on to too much of it. And while you're thinking about potassium, think about what you eat. Bananas, oranges, potatoes, tomatoes, spinach, all healthy, all loaded with potassium. That doesn't mean you can't eat them. It means you can't eat them like they're unlimited and expect your blood work to come back clean. Moderation changes meaning when your kidneys are handling potassium differently. And here's the thing your lab results are trying to tell you, if anyone takes the time to explain them. That potassium number on your blood panel, normal is between 3.5 and 5. If yours is creeping above 5, something needs to change. Not next month, now. Because the space between 5 and 6 is where the heart starts to feel it. If you know someone who takes Losartan or Lisinopril, send them this video right now, or drop a comment below. Someone reading it might recognize their own kitchen cabinet. Now let me ask you something. Do you have a dry cough? Not a cold cough. Not a phlegmy, productive cough. A dry, tickling, nagging cough that shows up at night, or when you're talking, or for no reason at all, and it won't go away. You've had it for months, maybe years. You tried cough drops, allergy pills. You thought about acid reflux. You even wondered if something was wrong with your lungs. And the whole time, it was the pill. Lisinopril, and every ACE inhibitor in that family, does something no other blood pressure medication does. It blocks an enzyme that breaks down a substance called bradykinin. That's a mouthful, so here's what it means in plain English. Bradykinin irritates the nerve endings in your throat and airways. When the enzyme that usually clears it away gets blocked by your pill, bradykinin builds up. Your throat tickles, you cough, and you cough again. And it doesn't stop because the pill doesn't stop. You take it every morning, and every morning more bradykinin piles up. Up to 1 in 5 people on Lisinopril develop this cough. 1 in 5. That's not a footnote, that's a crowd. And many of them never connect it to their medication because the cough doesn't start right away. It might creep in 6 weeks after you start the pill, or 3 months later, and by then you've forgotten the timing entirely. You're Googling chronic dry cough causes at 2 in the morning and reading about lung diseases you don't have. And you know what's frustrating? The fix is simple. Switch to Losartan. Losartan does almost the same job. Lowers blood pressure, protects your kidneys. But it works through a different door. It doesn't touch bradykinin. The cough goes away, usually within a week or 2 of stopping the ACE inhibitor. Just gone, like turning off a faucet. But here's the catch. Not everybody should switch. Lisinopril has specific benefits for certain hearts that Losartan doesn't replicate exactly the same way. So this isn't a decision you make by yourself after watching a video. This is a conversation you bring to your doctor with one sentence. Could my cough be from Lisinopril? That's it. That one sentence might end months of coughing. And while we're talking about things you can see and feel, if you're on Amlodipine, look at your gums. Really look. Pull your lip back in the mirror. If your gums seem thicker than they used to, if they're growing over the edges of your teeth, that's another thing Amlodipine can do. It's called gingival overgrowth, and it happens because the drug changes how your gum tissue turns over. Your dentist might spot it before you do, but now you know to look. So far we've talked about swollen ankles, painkiller traps, hidden potassium, a cough that won't quit, and gums that grow. And every single one of these is something you can see or feel from the outside. But there's a conversation we haven't had yet about what's happening on the inside, in the one organ that these medications change more than any other. And you're not going to feel it until something shows up in your blood work that makes your doctor pause. Your kidneys. That's the organ. And here's the paradox that kept me thinking for a long time. Losartan and Lisinopril are both prescribed to protect your kidneys. They genuinely do. They lower the pressure inside the tiny filters of the kidney, the glomeruli, and that protects them from being damaged by high blood pressure over time. This is real. This is proven. Millions of people keep their kidneys working longer because of these medications. And at the exact same time, these medications change how your kidneys filter your blood in ways that need watching, especially in the first few weeks. And especially if something else changes. You get dehydrated, you get sick, you add a painkiller, you go on a new diet. Think about it this way. Your kidneys filter about 45 gallons of blood every single day. They're working constantly, adjusting pressure, adjusting chemistry, keeping everything in a narrow range. Losartan and Lisinopril change the calibration of that system. They widen the outflow pipe from each tiny filter unit. That's how they reduce the pressure inside the kidney. They open the exit. And that works beautifully as long as enough blood is coming in. But if blood flow drops because you're dehydrated, because it's July and you've been outside all afternoon with a water bottle you forgot to refill, then there isn't enough pressure to push blood through a wider exit. And the filters stall. Not dramatically, not with a crash, just quietly, they stop working at full capacity. And if that goes on for days, the damage starts to add up. This is why your doctor runs blood work a couple of weeks after you start one of these medications. They're checking something called creatinine, a waste product your muscles make constantly, and your kidneys are supposed to flush it out. If creatinine goes up, it means your kidneys are slowing down. A small bump is expected. A big one means the dose needs adjusting or the drug isn't right for you. And here's what I need you to hear. If you've been on Losartan or Lisinopril for years and you've never had your kidney function checked since the beginning, that's a gap. Ask for it. It's a simple blood test. Two numbers matter. Creatinine and something called GFR, which stands for glomerular filtration rate. Your GFR tells you what percentage of normal kidney function you still have. Above 60, you're generally fine. Below 60, things need attention. Below 30, the conversation changes entirely. And dehydration is the accelerator. Every summer, emergency rooms see a wave of kidney injuries in people over 60 who are on these medications and didn't drink enough water during a heat wave. Not because the medication is bad, because the medication changes the rules and nobody told them the new rules. Drink more water than you think you need. If your urine is dark yellow, you're already behind. If you're dizzy when you stand up on a hot day, sit back down and drink 16 ounces before you do anything else. What I'm about to tell you next could change your evening routine. If there's someone next to you who needs to hear this, forward this video now before you forget. Sometimes a single link does more than 10 doctor visits. There's one more trap, and this one sits in your fruit bowl. Grapefruit. If you're on amlodipine and you eat grapefruit or drink grapefruit juice, you're changing how much medication actually reaches your bloodstream. Here's why. Your gut has an enzyme whose job is to break down part of the amlodipine before it ever gets absorbed. Think of it as a toll booth. It lets some of the drug through and breaks down the rest. Grapefruit shuts that toll booth down. So instead of getting the dose your doctor prescribed, your body absorbs more, sometimes a lot more. And that means lower blood pressure than expected, dizziness when you stand up, and a heart rate that doesn't feel right. This isn't a myth and it isn't overblown. One large grapefruit or one tall glass of juice is enough to suppress that enzyme for over 24 hours. Not just while the grapefruit is in your stomach, for the rest of the day. And it stacks. Eat grapefruit on Monday and Tuesday, and by Wednesday your amlodipine is hitting harder than your doctor intended. And now flip it. If you've been eating grapefruit regularly and your blood pressure has been well controlled, and then you suddenly stop, your blood pressure might drift upward. Because now that enzyme is back, breaking down part of your dose again, and you're getting less medication than before. Your body adjusted to the higher level. And nobody changed the prescription because nobody knew about the grapefruit. The fix is straightforward. Pick a different fruit. Oranges are fine, apples are fine, berries, bananas, anything that isn't grapefruit or Seville oranges. And tell your doctor if you've been eating grapefruit regularly. because your dose might need adjusting based on reality, not on what the math says. While I'm at it, alcohol. All three of these medications lower blood pressure. Alcohol lowers blood pressure too for the first few hours after you drink. Put them together and your blood pressure can drop further than either one alone would push it. That's why some people feel lightheaded or woozy after one glass of wine when they never used to. It's not the wine, it's the wine plus the pill. You don't have to quit drinking entirely, but you need to know that the floor moved. What used to be a casual glass of red with dinner now has more weight behind it. And one more thing that sounds small but isn't: standing up. When you're on any of these medications, your blood pressure is already running lower than your body was used to. Every time you go from